Hello, and welcome to your tutorial on the EDRN Hospitalist Border Documentation Handbook. So this handbook is located on B side on the front where the CSO nurses are, and it outlines all of the information that a border would need to have documented on them by the RN. This video is going to basically highlight the main differences. Please read through the handbook to get the details. As you can see, this is the contents of what is in the handbook. So as you can see, you're in your patient's chart, and you know they are a ED border because in their room number, you can see the orange and it's highlighted as border. Perfect. So now for the documentation, what you're going to do is you're going to go and find flow sheets. If it's not located at the top over here with the rest of them, you can hit these three dots, select flow sheets, and then you're going to search over here for the S24 adult patient. And what you're going to want to do is select on the S24 adult patient care summary, not profile. Once you've selected the care summary, you're going to hit accept. Now, this flow sheet will have everything that you need to document on. It's got plus some extra stuff. So it's got your ABCs, your focus assessment, your skin, your fall, daily activities, all that good stuff. Because it's kind of a long flow sheet with everything in it, you can go over to this search bar on the left and type in Braden, and that will bring you to the Braden risk assessment for skin breakdown. You'll fill that out. And then once you're done with the Braden score, then you're going to search for the Morse fall risk assessment. And again, you'll type that in the search bar, hit select. You can also scroll through the whole flow sheet. That's fine as well, but this is kind of a quick way to do it. And then you will document any fall risk items here, as well as any interventions once you're done. That's the main difference, is just the flow sheet and those two scales. Most of your border patients are going to have orders in their manage order page. So again, if it's not at the top, you're going to go to those three dots, select manage orders. You're going to go to active, and under the active orders, you're going to see medications, labs, code status, diet, PRN meds. You're also going to see any doctor to nurse or nurse to doctor communications. You're also going to see their admission or discharge status. You might see your neuro checks queue, 4 hours, vital signs, how often to complete them. So this will basically tell you what and when to complete patient items. So then if your patient is going to be discharged, the important thing to note, again, is you're going to go to your discharge or disposition tab, which is usually located at the top. You're going to select that. If their disposition here says admit, you're going to make sure that it says discharge. In order to change that, there's a couple different ways. One way is you can either click on the disposition word over here or your little pencil here. Either one will get you to the right screen. So as I said earlier, you see it says admit, but they're getting discharged. So you're going to select discharge so that way you can print out the paperwork. Once they are on the discharge status, you can go to the print/preview ABS. This is where you're going to add and subtract anything that you need. So sometimes you will see this first. It says after visit summary. You want to X that out, and you want to select ED ABS adult by adding the plus sign. and then it'll print out your selected documents. If they're going to a facility, obviously you're going to call report and you're going to print out the W-10, so you can add the W-10 by adding the plus sign. And if they're not going to a facility, then you would X that out. Then you'll be able to print out your ABS. The important thing is for these border patients that are going home, just let them know the last dose of antibiotic or medication, statin, whatever new medication that they had. Let them know the last dose that they had in the hospital and then the next dose for them to take at home. So, for example, if they're being discharged on a PO antibiotic, let them know, hey, your last dose was at 10 a.m. here in the hospital. Your next dose at home will be at 2 p.m. So those are the main differences. Here's a QR code. Please scan it to let us know that you've watched the video. Always reach out with any questions. We appreciate your time and patient care. Um, if you're not sure where to find the handbook, again, it's located on B side, and you can always ask one of us to give you another copy if you need it. Thanks so much.